Okay, guys, so today we're going to break down Chapter 5, Skin Analysis. So if you are in aesthetic school, taking aesthetics courses, or simply want to refresh yourself or learn something new, this breakdown of Chapter 5, Skin Analysis, might be helpful to you. So there are 11 objectives for Chapter 5. Number 1 is explain the process of the skin analysis. Number 2 is identify the 4 genetic skin types through visualization, palpation, and consultation. Number 3, differentiate the 6 Fitzpatrick skin types and accurately identify them. Number 4, distinguish the characteristics of sensitive skin. Number 5, recognize the intricacies involved with treating skin of color. Number 6, identify treatment options for the neck and décolleté. Number 7, illustrate examples of skin conditions. Number 8, explain the causes of skin conditions. Number 9, describe healthy habits for the skin. Number 10, determine treatment contraindications through evaluation, analysis, and consultation. And last, number 11, perform a skin analysis. So we're going to start with objective number 1, explain the process of the skin analysis. So being knowledgeable about skin types and conditions is one of the most important competencies of a skincare professional. This interaction with the client sets you up as a skincare expert. Recommendations for appropriate skincare treatments and products must be uniquely adapted to each person. The analysis is the determining factor in deciding what products to use during the service and what products to recommend for home use. Estheticians should study and have a thorough understanding of skin analysis because before performing services or selecting products, an individual's skin type and conditions must be analyzed correctly to determine the appropriate treatment type, treatments, and products. A thorough skin analysis and client consultation is especially important to determine the causes of skin conditions and any contraindications to the treatment or products that the client may have. And then lastly, using a holistic approach, identifying health habits and behavior that is detrimental to skin health will give you a better understanding of how to help your clients. Okay, so objective number 2, identify the 4 genetic skin types through visualization, palpation, and consultation. So we're going to start with what the definition of a skin type is. So we're going to identify the skin type. So skin type is a classification that describes a person's genetic skin attributes. That is the definition of a skin type. Okay. So it describes a person's genetic skin attributes. Skin type is determined by genetics and ethnicity, but like everything else, skin can change over time. Generally, skin becomes drier over time because our cellular metabolism and oil/lipid production slows down as we age. Skin type is based primarily on how much oil is produced in the follicles from the sebaceous glands and the amount of lipids found between the cells. We also have a definition for the T-zone. Okay, so the T-zone is the center area of the face corresponding to the T shape formed by the forehead, the nose, and the chin. Evaluating the pores in the T-zone is the first step in determining the skin type. In terms of visualization, palpation, and consultation, just know that palpation is how we examine the skin through touch. Manipulating it to determine conditions such as oiliness and elasticity. And we use consultation, conversing with our client to determine the lifestyle and dietary issues that may impact their skin. Okay. And in terms of visualization, that's just our ability to look at the skin either with our eyes by alone or under some sort of magnification through like a Woods lamp or a magnifier. So the definition for palpation is analyzing the skin through touch, and we're doing that to determine the oiliness, the amount of oiliness, and the amount of elasticity as well. Okay, there are 4 skin types. The 4 skin types are normal, combination, oily, and dry. And so we are going to break down each of those 4 skin types over the next few slides. So we're going to start with our normal skin type. So I'm going to give you guys some things to jot down and consider for your normal skin type. So as far as how normal skin looks and feels, okay? Normal skin looks and feel as far as the oil, it has balanced oil. You need to make sure that you know that normal skin is balanced. So it's not producing too much oil or too little oil. The hydration is also going to be balanced. So there's going to be a balance of oil and water. The follicle size for normal skin is going to be small. You will be able to see the small follicles or the small pores. And then how it looks, how it appears. Normal skin is going to have uniform luminosity. So it's going to have a uniform brightness to it, a uniform coloring to it. It's going to be rare that they have blemishes. If they do, it may just be very few. So they're going to have no blemishes or rare blemishes. And then how it's going to feel. Normal skin is going to feel soft. It's going to feel smooth texture. And it's going to have good elasticity. So how do we treat normal skin? Normal skin is treated best with maintenance and prevention treatments. Because the skin is already normal, so it's not like we have to really make any correction. So for your people that have normal skin, the goal is just to maintain and prevent, any skin conditions or situations. It also says to use the 4 steps to skin health. So for our people that have normal skin, we're going to always cleanse, we're going to always exfoliate, we're always going to nourish, and we're always going to protect. In terms of why people have normal skin, the text references the fact that the body systems are functioning holistically, meaning everything is in balance, everything is working in synergy. And then when a person has normal skin, it's most common for a person to have normal skin in their 20s and 30s. There are a few expert tips for your people that have normal skin. So you want to introduce anti-aging products as your clients mature. Also, normal skin will often become drier as we age, so just be aware of that. And then you want to also reinforce the use of sunscreen for your people that have normal skin. Okay, so the next skin type is combination skin. So combination skin, how it looks and feels, okay? It is going to have moderate to high levels of oil in some places. The hydration. It's going to, combination skin could have good hydration, but it also can be dehydrated. So I want to say something about dehydrated skin. I want you to know that all skin types can become dehydrated. Okay. So for our combination skin people, I think I have to sneeze, guys. So for our combination skin, hydration may be good or good to dehydrate. The follicle sizes. So they're going to have larger follicles or pores in the T-zone area than they do on the sides of the face, right? So you're going to see more oiliness in the T-zone and dryness in the outer areas. I also want to highlight the fact that it can also be reversed, depends on what they're doing, right? We can have different textures and also different amounts of oil levels. So it could be that sometimes it may be drier in the cheek area, which is not common. Oilier in the cheek area and drier in the T-zone, right? It could be either or. The appearance, so combination skin. They can have buildup of dead skin cells and oil in their pores around the nose, but dry or flaky skin outside of the T-zone. They also may have some blemishes. They also may have some comedones. And then the feel of combination skin. It is going to feel oilier in the center T-zone than on the sides of the face. So how do we treat combination skin? Our people that have combination skin, they need regular cleansing, they need regular exfoliation, they need water-based products, and you also want to avoid harsh products or rough exfoliation for those skin types. And then as far as the why they have combination skin, well, there's just simply an overproduction of oil in the T-zone, and then they may have normal or oil production in the T-zone and dehydrated skin on the sides of the face. So that's the why in terms of the combination skin. A few expert tips that the text gives us. It says to evaluate this skin type often, as oil hydration balance can be disrupted by hormonal or environmental influences. And then you also want to reinforce the use of sunscreen for your combination. So our next skin type is oily skin. As you can see, looking at her skin definitely looks shiny. For our oily skin types, the look and feel of it, their oil levels are going to be moderate to high. And as far as hydration, just like combination skin, they can also have good hydration, but oily skin can be dehydrated. So as far as their hydration, it can be good all the way down to dehydrated. Okay. The follicle size for your oily skin types, they're going to have the most noticeable follicle sizes. You may be able to see their large pores without even having to use a magnifying lamp. Okay. So their follicle size is moderate to large. And then as far as the appearance of their skin is going to look shiny. You may see some comedones, meaning you may see some blackheads. You may see some blemishes that are present. Okay. As far as how it feels, so oily skin feels thick. It's a thicker texture as you're manipulating the skin, and the skin may also be firm, but you also may notice some unevenness in texture as well because of the comedones, whiteheads, and other things. If they have acne, so you may feel more texture in your oily skin clients due to congested follicles, basically. Okay. As far as how to treat our oily skin clients, so regular cleansing and exfoliation is going to be the key for them, and they are going to need hydration with water-based products. So for your oily skin clients, you want to stay away from anything that's going to be occlusive, anything that's going to further block the follicles. If water-based massage products, water-based moisturizers, anything that's going to be light is going to be great for your oily skin clients. And then you also, in your treatment room, you may be providing treatments to them that's going to help to balance out that oil production, maybe slow down some of that oil production. Okay. As far as why they have oily skin, these clients have oily skin because of the overproduction of oil due to genetics, hormonal changes, medications, could even be stress or environmental factors such as maybe where they work or using the improper skincare products or maybe using makeup that is comedogenic. Also, be mindful of your exfoliation methods with your oily clients because it says that over-exfoliation will basically create more oil. So don't try to over-exfoliate them because the skin is just going to do nothing but react and produce more oil. And then as far as our expert tips, so it says that clients with oily skin breakouts and comedones may have them on their neck, their back, their shoulders, and their chest. So if they have oily skin on their face, they're probably going to have oily skin in other areas as well. Okay. May have some back acne, may have some chest acne, so that may be, through your consultation, your opportunity to see if you can add another service and treat other areas that they may need. Also, it says clients with oily skin age more slowly, and that's because the oil acts to protect the skin. So having oily skin is not as bad when in terms of aging because of the oil production. The oil keeps you looking younger, but the oil production does lead to like skin conditions. And then it also says that clients will need to use SPF regularly to avoid post-inflammatory hyperpigmentation. So what that means is like your clients that have oily skin, like we may have to do extractions, and they may try to extract themselves, which will cause them to have some post-inflammatory hyperpigmentation. So you may be treating your clients that have oily skin with also like a skin lightener, some vitamin A products to reduce the post-inflammatory hyperpigmentation. So be mindful that those clients may have that ailment. Okay, a lot of times they have that post-inflammatory hyperpigmentation as a byproduct of having acne. Cool beans. All right. So now we have our dry skin types. Okay, our dry skin clients. So for our dry skin people, how it's going to look and feel. In terms of oil, they're going to have very minimal oil production. Very minimal oil production. Hydration. They're going to also have probably minimal production of hydration. The follicle size. So their follicle size is going to be difficult to visualize. So you're going to be able to barely even see their follicles by looking at them under a magnifying lamp. This skin is also going to lack luminosity, so it's not going to be bright. It's going to probably look more dull than anything. They're going to have may have some flakiness, may have some blotchiness in their skin. And then how it feels, it may feel rough. Also, dry skin feels thinner because it doesn't have any hydration or oil to pump it up. So it's going to feel thinner, and it's also going to feel tight. It's not going to have as much elasticity because it is dry. How to treat dry skin. So these slides do benefit from your oil-based products to provide protection of the acid mantle. When you hear me say acid mantle, I'm talking about the barrier function, right? What we need to help retain moisture and hydration within the skin. So for them, they need oil-based products to protect the acid mantle and increase the barrier function. Also, they need treatments that's going to provide nourishment and protection. Okay. And as far as why their skin is dry, it's because there's an underproduction of oil due to either genetics, environmental factors, or hormones. Okay. As far as our expert tips, so it just says that dry skin may often be dehydrated as well. So know that it can be dry and dehydrated. And then for them, we also need to reinforce the use of sunscreen. Okay, guys, so we have objective number 3, which is to identify or differentiate the 6 Fitzpatrick skin types and accurately identify them. And so, as in terms of the Fitzpatrick scale, it was developed by Dr. Thomas Fitzpatrick. And what the Fitzpatrick scale does is it measures the skin type's ability to tolerate ultraviolet exposure. So basically, sun exposure. Many skin treatment protocols are based on the client's Fitzpatrick skin type. Due to mixed genetics, there is no true phototype classification. Therefore, the scale is just a guideline. But most of the skincare companies, modalities, and lasers, they always use the Fitzpatrick scale to help us as an esthetician determine when to use, what to use, and what not to use. Okay, so let's get into our first few classifications of the Fitzpatrick scale. So the Fitzpatrick scale goes from 1 to 6, 1 being the lightest skin type, 6 being the darkest, and then there's other attributes for the Fitzpatrick skin scale. So your Fitzpatrick 1, as you can see the lady on the left, your 1s are going to, in terms of reaction to UV exposure, they're always going to burn. And they peel with no burn. And they never tan. So your Fitzpatrick 1s, they're always going to have blue or green eyes in their hair, maybe either blonde or red. I'm assuming that they use a red head for our Fitzpatrick 1, just so that we can know that your red heads are always going to be Fitzpatrick 1. And also a unique thing about redheads, they they are hard to numb. They resist uh, anesthetics. That's numbing. It's hard for them to numb. So like even if they go to like the dentist, they may have to get extra numbing, and it's just something about them just being like a natural redhead. Um, as far as their unexposed skin, so if they haven't been in the sun, their skin's gonna look very white, almost translucent. They also may have freckles, and then their heritage slash heredity, they're gonna usually be English descent, Irish descent, Scottish descent, or Northern European. Cool beans? So that's your one. And again, they always burn. They are going to peel without burning, and they never tan. So number 2, our Fitzpatrick 2. Our Fitzpatrick 2s, as far as their skin's reaction to UV exposure, they burn easily, and they usually always peel, and they tan minimally. If they do tan. As far as their eye color, blue, hazel, or brown are common eye colors for your Fitzpatrick 2s. And then their hair may be red, blonde, or brown. So your redheads may be between a 1 and 2. Most of them are going to be a number 1. And then their unexposed skin is just going to look light. Okay. Their heritage and heredity, they may be Scandinavian and also the same as those in your Fitzpatrick 1. So English, Irish, Scottish, Northern European. Our next skin type are our 3s. Okay, so as you can see, we get a little bit darker skin, darker hair. So your Fitzpatrick 3s, they are going to tan very well, or they're going to tan well and burn moderately. So they may burn then tan. As far as their eyes, they're going to have brown eyes, they're going to have dark hair. Their unexposed skin is going to be fair to an olive tone. And then as far as their heritage and heredity, they may be Spanish, they may be Greek, or Italian. And if we look over to our Fitzpatrick 4, he's getting a little bit darker. Hair is still dark, eyes are still dark. As far as the reaction of UV exposure in your Fitzpatrick 4s, they tan very easily, they burn minimally, and they also experience an immediate pigment response. So what that means is their skin reacts and starts to get a little bit darker after minutes of being in the sun, or within the 30 minutes. So you can tell if they've been outside. Next, we have our Fitzpatrick 5s and our 6s. All right, so a little bit darker on the scale. Your 5s, the eyes and hair are going to be dark. Unexposed skin is going to be dark brown. The reaction to UV exposure in your Fitzpatrick 5s rarely ever burns, tans easily and significantly. And then the heritage and heredity: East Indian, American Indian, Hispanic, Latin American, and African American. And then our Fitzpatrick 6s is the darkest on the scale, dark hair, dark eyes. Their unexposed skin is going to be dark brown to black. Again, the heritage and heredity is going to be African American to Aboriginal, and then the skin reaction to UV exposure rarely or never burns and tans very easily. So those are going to be the 6 Fitzpatrick skin types. All right, so other classification systems that are sometimes used to analyze the skin is the Glogau scale and the Rubin scale. The Glogau scale, I want to say that it measures wrinkles. If it's not that one, then it's the Rubin scale that measures wrinkles. But you guys can go down the rabbit hole with those two. You should not have any questions about the Glogau scale or the Rubin scale on your Texas esthetician exam. But again, if you just want to familiarize yourself with those, you can go down that rabbit hole and look that up. All right, so next up is objective number 4, distinguish the characteristics of sensitive skin. Okay. So sensitive skin is a condition, but it's also a result of genetic predisposition. It is characterized by fragility, so it's very fragile. It's thin skin, and it has redness. It flushes very easily, meaning that client may turn red very easily and may appear red due to blood flow being closer to the surface. Okay. Clients with Fitzpatrick skin type 1 with heritage that is Northern European tend to have fair, light-colored skin that is thinner and more sensitive. Individuals with multicultural skin can be sensitive without visible redness. So basically, everybody can have sensitive skin, but the darker your clients are, it may be harder to determine because our redness doesn't show up as easily because our skin is darker, right? It also says that sensitive skin is easily irritated by products or by exposure to heat or sun. And then telangiectasia is a term that you need to know. Telangiectasia. You can find that word on page 169. So telangiectasia is visible broken or distended capillaries, less than 0.5 millimeters, due to intrinsic or extrinsic causes, may be noticeable on sensitive skin. So telangiectasia is like you'll be able to see little bitty capillaries on the surface of the skin that also makes the skin appear red. Whenever you hear distended capillaries, that means they're open and there's blood flowing through them, giving like a reddened look to the skin. There's something else I was going to say about telangiectasia and sensitive skin. So I will say that sensitive and sensitized skin can be difficult to treat because of its low tolerance to products and stimulation. So for example, excessive rubbing, heat, exfoliation, or extractions can cause damage and increase the redness. Sensitive skin needs to be treated gently with non-irritating, calming products and treatments. It is important to find out what could be causing sensitive skin conditions by completing a thorough skin analysis. Okay, so is it a natural part of the skin condition or is it something that the client is exposed to? The primary treatment goal for sensitive skin are to soothe, calm, and protect their skin. So our next objective is objective number 5, and it is recognize the intricacies involved with treating skin of color. So when it comes to treating skin of color, okay, all Fitzpatrick skin types have the same number of melanocytes. And melanocytes are the cells that produce the melanin within our skin. Higher Fitzpatrick skin types have melanocytes that produce more melanin. Melanocytes comprise about 5 to 10% of the cells in the basal layer. Most of the differentiation is dependent on the ethnicity of the individual and the geographic location. A person who lives along the equator will have much more active melanocytes than the person who lives at the North Pole. In addition to these considerations, each of these skin types has specific considerations. So, Fitzpatrick 4. Okay, I'm going to go over to Fitzpatrick 4. They are deemed the most challenging to treat because they're right in the middle of the Fitzpatrick scale. So, what the text says is that it's considered to be one of the most challenging skin types to treat well. It has great elasticity and firmness and does not show signs of aging as quickly as your Fitzpatrick 1s and 2s. However, they can become hyperpigmented from treatments or aggressive exfoliation. So gentler exfoliation products are recommended for these clients. They also may need to add melanin suppressants or what we call tyrosinase inhibitors or other skin lighteners to their skincare routine. And this skin type requires sun protection to slow down hyperpigmentation. They must avoid sun exposure and use sun protection daily, especially for anyone who is prone to hyperpigmentation. Fitzpatrick skin types 3 and 4 typically have thicker skin that is usually characterized by more oil production and needs more deep cleansing treatments. Okay, so your pores may also need deep cleansing treatments, but also gentle exfoliation. Additionally, waxing. Waxing is more difficult for individuals with any fitzpatrick skin type that has thicker hair and thicker roots in the follicle. So if you want to specialize in skin color, explore educational resources and advanced classes for this area of study. No matter what a client's skin type or ethnic background is, everyone needs an individual skincare consultation and treatment plan to maintain healthy skin. Okay, next up we have our 5s and 6s, and our 5s and 6s can also be a little bit challenging to treat. So what the text says about our 5s and 6s is that generally they have oilier and thicker skin in the dermis, but can have the same level of reactivity as lower fitzpatrick skin types. So don't assume that just because a person has darker skin that they can handle anything that you do to them. That is not true. Reactions may be more challenging to see on the darker skin, but they may be just as intense as those on lighter skin. Your 5s and 6s are prone to form, they're prone to a form of hyperkeratosis known as ichthyosis and dead skin cell buildup. So these clients need more exfoliation and deep pore cleansing. So your 5s and 6s also need that deep pore exfoliation. They may have those clogged follicles, may have the dead skin. And then it also says that they may have abnormal hypertrophic scarring. So your 5s and 6s are going to be more prone to keloids. We learned about keloids in our last chapter, chapter 4. And then SPF, sun protection, is also necessary for your 5s and 6s. So again, everybody needs sunblock. Okay. So we are now at objective number 6, identify treatment options for the neck and décolleté. So the skin on the neck and décolleté pertaining to the lower neck and chest is not the same as the skin on the face. The neck and décolleté have fewer sebaceous glands, so you need to write that down, understand that, add it to your notes. So the neck and décolleté have fewer sebaceous glands than the face, so they tend to show aging more quickly. The neck and décolleté are more susceptible to irritation. Photo damage, broken capillaries, fine lines, and rhytides, which are wrinkles, develop just as much on the neck and chest as they do on the face. And there's this new term called technic, okay? Because we're in this age of technology. Everybody has a smartphone or device. So it's a new phenomenon caused by the repeated movement of looking down at a cell phone or other electronic devices, which has created a demand for specialty topical treatments that include antioxidants, growth factor serums, and additional moisture. Be cautious when applying vitamin A or alpha hydroxy acids products to this area because it may cause irritation. So generally, your clients are not going to need any kind of vitamin A products or any alpha hydroxy, any pills in this area because there's already fewer sebaceous glands, so there's less oil production. A product such as retinol may be fine for the face, but too aggressive for the neck. So just remind your clients that the neck and décolleté needs SPF protection just as much as the face does. All right, so we have objective number 7, illustrate examples of skin conditions. So in your textbook, there are about 3 pages worth of skin conditions, various skin conditions that you may see in your treatment room. So many internal and external factors affect the conditions of a person's skin. Skin conditions are more than our genetic makeup. These conditions are what the esthetician is most concerned about, and they are focused on skin treatments. Some of the most skin conditions estheticians see today are adult acne, extrinsic aging, meaning from sun exposure and the environment, and problems related to hormonal fluctuations. Dehydration and pigmentation disorders are also significant concerns for clients. Other skin conditions include comedones, hyperkeratinization, and erythema, which erythema means redness. So we can improve some of these conditions through regularly scheduled skin treatments by using specialized products and by avoiding the factors that affect the conditions. We're going to take a look at a few of these conditions. Again, this chart, there is a chart on that starts on page 172. And I want to just go through all of the ones that are present on the slideshow. I don't believe that the chart highlights every single thing. So, again, I recommend that you go into your textbook from 172 to 174, maybe make yourself some flashcards or print off that chart, put it in your binder as a resource because these are going to be the common conditions that you may see. So, starting with acne, the description of acne from our chart is a sebaceous outbreak from hormonal changes or other factors. So if you want to add that, cool. Then it skips down to comedones. So comedones, they are open comedones or blackheads and clogged pores caused by buildup of debris, oil, and dead skin cells of the follicles. Closed comedones are also known as whiteheads, are not open to the air or oxygen. They are trapped by dead skin and need to be exfoliated and extracted. So we have two types of comedones. You have open and closed. Okay. The open ones are blackheads. We can extract those easily. The closed ones are whiteheads, and they have to be exfoliated and extracted. Okay. Then you may also notice that your clients may have some cysts, maybe acne cysts. So what a cyst is fluid infection or other matter under the skin that is encapsulated into a palpable firm mass of varying sizes from the size of a pea all the way to the size of a golf ball. Okay. Other skin conditions, herpes simplex, that's something that you may see in a treatment room. It is a communicable virus that appears as a vesicle on the lip, similar to a blister. You can find more information in that chapter on diseases and disorders of the skin. Hyperpigmentation is something that you may also see in your treatment room. So hyperpigmentation. So what it says about that is overproduction of melanin due to at least one of the three factors. So overproduction of melanin due to UV exposure, such as sun, tanning beds, fluorescent lighting. This usually appears as diffuse brown spots of various shades on the skin. Your hyperpigmentation can be hormonally induced, which we call that melasma. Or we also may see post-inflammatory hyperpigmentation, also called PIH. And it occurs from a surface injury to the skin, so like acne lesions, insect bites, and ingrown hairs are common causes of post-inflammatory hyperpigmentation, and they can appear deep red, almost purple, to dark brown in color, and they do gradually fade. You also may see hypopigmentation in your treatment room, so it's going to be a lack of melanin due to a few different factors. This too is UV induced, so it's intermingled with UV induced hyperpigmentation. There are no treatment options, but lightening the hyperpigmentation will usually blend the hypopigmented areas so that less noticeable. I'm not sure if I really recommend that, but I mean, it may be a thing. That's just what the text says. Post-traumatic hypopigmentation. So that happens due to a lack of melanocyte production due to an injury, a burn, or other trauma, including a deep chemical peel. So we got to be careful with our chemical peels so that we don't cause our clients to have hypopigmentation. Melanocytes may begin producing again over time, but the length of time is undetermined. Other reasons why a person may have vitiligo, hyperpigmentation, they may have vitiligo, or they may suffer from albinism. Vitiligo is an autoimmune disorder that stops melanin production and creates patches of depigmented skin. Usually topical prescription drugs can trigger the rejuvenation of melanocytes, and then albinism. Albinism is a hereditary disorder causing lack of pigment in the eyes, skin, and the hair. You may also see keratosis pilaris in your skin, in your treatment room. So keratosis pilaris is just simply put, It's a buildup of cells, and their skin may have a rough texture, so you can get rid of that with exfoliation. And then melasma, again, it's a form of hyperpigmentation. You may see that usually due to hormonal imbalances like pregnancy, birth control pills, or hormone replacement therapy, but you may see hyperpigmented areas on the jawline, the forehead, and or the upper lip. I think we understand what papules and pustules are, but a papule is just raised lesions. A lot of times we call them blemishes. And then a pustule are infected papules with fluid inside. And then you may also see seborrhea. So I think this is a great picture of what seborrhea may look like on the right-hand side. It's also known as seborrheic dermatitis. And it's caused by excessive oil production that causes redness, irritation, and flaking. And it occurs most commonly in the hair's dandruff. You may see or identify sensitivities, such as, and basically these are going to be physical reactions such as erythema, which is redness, edema, which is swelling. You may have a wale, some itching, some sting, or discomfort from internal or external influences on the skin. Earlier, I talked about telangiectasia. So as you can look at this picture, you can see the small, broken, or distended capillaries on the skin. And then, lastly, we will be treating a lot of, for our more mature clients, wrinkles, aging. Wrinkles, the technical term for wrinkles is rhytide. So these are some of the common things. The chart does give us way more options and a list of things, a larger list of things that we may see in the treatment room. So those are the skin conditions. And again, make sure that you make yourself a cheat sheet, make a flashcard, pull out those pages from your textbook, take a screenshot, or what have you. All right, so we have up next objective number 8, explain the causes of skin conditions. Okay, so understanding what can affect the skin will determine why a client may be experiencing problems and how to improve or correct the condition. Estheticians must evaluate multiple causes, both external and internal. So as we look at this chart, basically there's two things that ages us. Either we have intrinsic aging, right? Intrinsic aging is things that we don't really have control over, okay? Or internal things, right? So things that we don't have control over: time, our genetics, gravity, right? Your extrinsic, because you're going to see those two terms. Extrinsic means anything that's external that causes the aging. So, sun exposure, smoking, drinking, stress, having an unhealthy diet, lack of sleep, lack of exercise, okay? Signs of aging. Signs of aging may include hair loss, gray hair, thinner skin, drier skin, wrinkles, hollowed out sockets because our buccal fat in our face tends to diminish, socking cheeks. Okay, so these are all things, examples of what ages us. So hopefully we don't have any questions about intrinsic versus extrinsic. Okay, so again, our external factors: UV exposure, sun damage, tanning beds, environmental exposure, pollutants, the air quality. I went to New York about a little while ago, right? And I noticed I came back, my skin was congested because that city is so full of pollution, right? So the environment, climate, humidity, poor maintenance or inappropriate skincare, misusing products, overexfoliation, or harsh products, those are also external effects. Allergies and reaction to the products, photosensitivity to the sun from medication or products are external effects. Our internal effects, again, like I mentioned, genetics, dehydration, free radicals, vitamin deficiencies, hormones, medical conditions such as chronic illnesses like cancer, systemic diseases like diabetes, impaired immune function, puberty, aging, glycation. Okay, y'all remember that term, glycation? that too much sugar alters your DNA. That it basically breaks down those cells. Okay, pregnancy and menopause. Okay, so those are all of the external and internal factors that affect aging. All right, so we have objective number 5. Describe healthy habits for the skin. So there's the top 10 healthy habits for skin. All right, so number 1 is avoid sun exposure and use sunscreen daily. Number 2, eat a balanced diet as much as you can. Don't smoke. Avoid excessive alcohol. Drink plenty of water. Get plenty of rest. Okay. Stay active and exercise regularly. Use beneficial skincare products and regular home care routine products for your home care routine. Get professional skincare treatments. That's our shameless plug because everybody needs to come and get professional skincare treatments from us. And then number 10, implement stress relievers and maintain a calm and positive attitude. Okay, guys, so we're almost done. We are at objective number 10. Determine treatment contraindications through evaluation, analysis, and consultation. So the word contraindication, okay, these are factors that prohibit a treatment from being performed or the use of certain skincare products being used on a client's skin. Okay. So certain treatments and skincare products may be contraindicated for a particular client, and it is your responsibility as an esthetician to evaluate the appropriateness of the treatment and skincare products after your skin analysis and review of the client's medical history. These contraindications are factors that prohibit a treatment from being performed or, again, a product from being used on a client's skin. Certain treatments could cause harmful or negative side effects to those who have specific medical or skin conditions. The client may list these on their client questionnaire, but recognizing diseases is vital to avoid causing harm to clients or to you. Clients with obvious skin conditions such as cold sores or abnormal looking conditions should be referred to a medical provider for evaluation and approval of the aesthetic treatment. Okay, so I do want to talk about, so there's a chart on page 178 which is going to break down, if y'all see that second bullet, use of isotretinoin and other things. So I'm going to read a few things from that chart on page 178. So use of isotretinoin, the client must have completed isotretinoin 6 months prior. Isotretinoin is a lightening and brightening air medication. So isotretinoin is definitely Accutane. If you see that on your client's intake form, I typically recommend that you wait about 6 months. 6 months to a year, maybe closer to a year, to treat those clients because their skin has to regenerate. And also, if you see that they use Accutane or isotretinoin on their intake form, no waxing, nothing harsh, I probably would just get them to get a release from their doctor to say it's okay to get this service done. Other things that may be a contraindication, they have thin skin, or if they're using other exfoliating topical medications, or if they're pregnant. Okay. There's also other contraindications that we may come across. They have metal bones or pins replaced in their body, or pacemakers or heart irregularities. We may not be able to use most of our modalities in our treatment room. If they have any allergies to anything, for obvious reasons, right? If they suffer from seizure or epilepsy, light treatments are not going to be the thing for them. And also, some of your skincare devices are not going to be good for your people that have epilepsy or seizures, because if it shocks them, it may have them to go into have an episode with you. So, other contraindications, if they use oral steroids like cortisone, if they have certain autoimmune diseases, if they're diabetic, or if they are using blood thinners, including NSAIDs, which that's usually found in like your Tylenols and aspirins, they may be contraindicated for some of your treatments. So when it comes to like these autoimmune diseases and things like diabetes, if they're controlled, it's fine. So I don't want you to see those on your intake form and say, oh, you have diabetes, I can't treat you. if they are controlled and taking medication, it's fine. It's when it's uncontrolled where it's really a problem for you. But if all else fails, if you're not comfortable, err on the side of caution and just get the approval from their doctor to make sure it's okay for them to receive the treatment. In terms of your client consultation, so the most important reason for a client consultation is to determine if the treatment is appropriate for the client or that the skincare products will benefit the client's skin. It'll also help you to determine why a client is unhappy with their skin and what internal and external factors are causing any skin problems. The more you know about your client, the more appropriate recommendations you can make about skincare treatments. So, in order to prepare for your consultation, is it? Sorry. It's important to be prepared for your consultation. So you want to facilitate the consultation by asking the following questions. So, is your client comfortable? Ask yourself, is your work area freshly clean or uncluttered? Do you have the appropriate tools ready to use? And do you have the materials to explain the benefits or the ingredients? You also want to know or ask yourself, do you have a step-by-step photos of the actual treatment process? And then will you be able to discuss who the best candidates are for specific treatment? So these are things that you want to be able to do as an esthetician, right? So it's very important to take your befores and afters. It's important people want to see the changes that you can make. So you need your portfolio. And then you also need to be able to confidently explain to them why they need something or why that you need to be able to explain the benefits of given treatments or products. Okay, so here is an example of an intake form. This is going to be the staple of your consultations. Your intake form obviously is going to gather information about them. You may call this your client questionnaire. You may also call it your health history form or your consultation card. So clients should complete a confidential intake form, and you want to update it at each visit. So at the very minimum, I recommend getting into the practice of asking clients, hey, has anything changed since you've last been here, right? So that if you do need to update something, you can, okay? What this form does is it discloses your client's health history, all products and medications, medical conditions, known allergies, sensitivities, what their known home care is. So that's basically the client's consultation. I don't think I need to break that down or beat that dead horse. I want to clarify, though, there's a difference between a consent form and a consultation form. The consent form covers you, right? It also gives you the authority to treat them. The client is saying, I recommend adding language in there in your consent forms where they release and hold you harmless. Because sometimes people will people. And they may say that you're the reason why they have this outbreak or whatever the case may be. So I would definitely, you can combine all your forms together on one, or you can make them separate. It's your choice. But the main thing, you want to make sure that they sign and print, and you also print as well. But ultimately, this covers you as an esthetician. Okay. As far as your client chart or service record chart, I think this is great. This is just going to help you to record any notes from the skin analysis, make any recommendations, and just record what you're recommending for your client. So you guys can make this one big packet. You can make it in an online form, or it can be a physical form. It's your choice. Okay. Questions are asked during the consultation. What's the reason for their visit? Why are they there? What have them to share with you any skincare concerns that they may have. Talk to them about their skincare goals. What is it they would like to see? What changes that they would like to see in their skin? Talk to them about their home care routine. You want to know what they're using at home so that you can say, okay, we need to get you on some better products. That's your opportunity to retail. their home care system. You also want to talk about prior treatments because you just simply want to know what they've had before, what they're used to. And then you want to know any allergies to products or allergies to scents because some people are allergic to different aromas. You also want to ask about the normal state of their skin. So on a normal day, what do you notice about your skin? Is it drier or on the oilier side, et cetera, et cetera. You want to talk about the feel of their skin during different times of the day because the way a person's skin may feel in the morning when they first wake up may be very different from how they end their day. So talk to them about that. Ask them, do they wear sunscreen and sunblock? A lot of clients are going to say no. Some of them are going to say yes. More women are going to say yes. Your men are going to say no. Ask about their diet. Ask about their water intake. Y'all, the water intake is very essential, not only for skincare, but like if you're waxing or like a sugar, if the more your skin is hydrated, the easier the hair comes out. It's easier on your clients. And then ask about their activity level. Then you want to know, hey, are you a smoker? Okay, do you have any other allergies, or do you have any lifestyle stress, or have you had any prior aesthetics procedures? So those are some of the things that you want to consider for the consultation. Next, we're going to get into the skin analysis. All right, so we are on the last and final objective. Yes, we made it to objective number 11. Perform a skin analysis. Okay, so knowing how to analyze the skin is the first step in providing skincare treatments and recommending products, identifying conditions and contraindications, providing a thorough consultation, and charting client notes are all elements of good aesthetic practices. Become adept at a quick skin analysis in the waiting room, as sometimes clients need quick product recommendations or are not sure of what type of treatment to schedule. So knowing the skin types, conditions, and factors affecting the skin's health enables you to give an accurate skin analysis. The best tool for your skin analysis is a Woods lamp. It is a filtered black light that is used to illuminate any skin disorders, any fungi that's on the skin, any bacteria, and deeper levels of pigmentation. And an electronic photo image system can also be helpful. And that is it. We will be analyzing skin. You guys will be learning some practicals this week. This is our summary and review. So developing your skin analysis abilities will help lead you to success. Possessing a comprehensive understanding of how intrinsic, internal, and extrinsic, external factors contribute to your client's skin condition will give you insights that will allow you to suggest a treatment plan of skincare products and services to best address your client's needs. Products can be formulated for different skin types. A classification that describes a person's genetic skin attributes and conditions. And everyone falls somewhere on the Fitzpatrick scale in terms of how their skin reacts to the sun or UV exposure. The consultation, health screening questions, and client chart are all used as part of an in-depth skin analysis. The client chart is used to record the analysis and consultation notes, an important part of record keeping. And the 4 components of the skin analysis are to look, feel, ask, and listen, and be sure to record your findings. That is the end of our chapter 11. These are all of chapter 5. These are all of the 11 objectives that we covered, and we hope that you have gained some valuable knowledge, and we have answered any questions for you regarding skin analysis. We hope that you have a great day, and we will see you later. Bye.